Hey, I'm Joe Heiler. I'm the owner of Elite Physical Therapy and Sports Performance, and in this video we're going to talk about Graston technique. And I just want to introduce the technique, and what it is it's a form of instrument-assisted soft tissue mobilization. And what that means is I'm using instruments, in this case stainless steel instruments. There's 6 of them with different shapes and sizes, different types of treatment edges to fit different body parts. And basically the instrument is just replacing what my hands would normally be doing as a physical therapist. And then the soft tissue mobilization component of that, an example, most people would think of massage, or in physical therapy, we do different techniques like myofascial release, deep tissue work. Those would all fall into that category. And the nice thing about using the instruments is there's a lot of advanced techniques we can use as well, things we can do while the patient is stretching or doing exercises, while they're doing things in standing, or adding load to their work while we're doing the soft tissue release. Things that would be quite difficult for me to actually do with my hands. And so the nice thing about the instruments too is I can feel, when I'm working on someone's tissues, I can feel the tissue, soft tissue lesions, just like I would if I was using my hands. And many times when I find a spot, the patient can feel that same texture. They can feel what I'm working on. And I can cover a much larger area in much less time. And what that ends up doing is I can get through treatments quicker, and it's quite effective, and we end up having less treatments overall. So it's been very nice in the clinic that way for relieving pain, improving extensibility of the tissues, and improving function relatively quickly. So I want to do a quick demonstration, and the kind of the condition we'll talk about working on the foot is plantar fasciosis. Most people are familiar with plantar fasciitis, and when you hear the itis, it just means it's an acute inflamed situation, and we do see some of those as well, but most of the time what we're going to deal with in physical therapy is the plantar fasciosis. And when you hear the osis, that's a chronic condition that's no longer inflamed, but the tissue's actually changed in its actual substance. So what we need to do with the instruments is actually kind of kickstart that inflammation process again, which is really just restarting the healing process. And what we do, I'm just going to use a larger instrument, what we call GT4, and just working through the foot and working through the muscles and working through the different tissues. And a lot of times we really don't have to push real hard and cause a lot of pain to get results. What we do is just changing which instrument we're using, or changing the position of the foot. In this case, if I put the bottom of his foot, the tissues are on some slack, I can work a little deeper into the muscles this way without having to apply a lot of force. And if I wind his foot up, put him on a big stretch, this is going to be a more superficial treatment. This would be more of what you would think of like as the myofascial release, or working the thick fascial tissue on the bottom of the foot. And again, I don't have to go very hard on him. I just change the position to get the effect that I want. Switching which instrument I'm using, so this is what they call GT3. It's a little more specific with that smaller tip. So again, if I find something specific in a muscle I want to work on, I can really get in deep without having to apply a lot of pressure. Or where the fascia attaches up underneath the medial aspect of that calcaneus, I can really get right up in under there and do some work to treat out that tissue, create some more extensibility in that tissue, create an inflammatory response to kickstart the healing process. Again, so this is just kind of a quick example of how we would work on the foot, but very similar to many of the other techniques we use in different parts of the body as well. So if you have any questions about Graston technique, feel free to email us. The email is joe@elitepttc.com, or you can always call us at 231-421-5805.